Dr. Paul Volz, Run Veterinary Clinic. How are you doing this morning?
I'm doing well. How about you?
I'm doing all right. As we were
Okay.
talking about just a moment ago, it feels like every day is Groundhog Day. But I
Okay.
understand today is a day off and out of the practice for you.
Yes, I have different days off and to make up for working on weekends.
Fair enough.
Okay.
So let me ask the question that I suspect is going to be on absolutely everyone's mind. 4 tigers, 3 lions at the New York Zoo, reports of domestic cats picking up COVID-19. What's the story? Can our pets get sick right now?
Yes and no. When it comes to cats, they're a little bit different. There are certain species that this particular virus can get into more easily. Cats, ferrets, and as we all know, people are very good at picking up COVID. They pretty much found that dogs, pigs, ducks, chickens, things like that, they really don't, they might be exposed to the virus. They may actually have the virus trying to multiply in them, but they're not a good host. Their cells are not the best home for this particular virus. Whereas in cats, ferrets, and chickens, it really likes those. But cats do not get that severe disease. There's been a few cats that have had very mild upper respiratory infections, like the cats in New York. There was some cats in Hong Kong that tested positive. Some had no disease whatsoever. Some had very mild upper respiratory infections, and they all survived without a problem. And the key to this whole thing is that or people in general, there is no evidence across the planet in any country that any animal gave a person COVID-19. It has not been shown that that transfer has ever happened. And consequently, our pets are not a big reservoir for us. It's the other way around. The pets are actually the ones that are at risk because their owners or their caretakers have coronavirus. And that's all of the cats in the Bronx Zoo, they were all exposed to the one same handler. Now, interestingly enough, not all cats can even have a problem with it. Like in the Bronx Zoo, there's 8 different species of big cat. 2 of the species, tigers and lions, got the very mild upper respiratory infections, which can happen in cats. But the other 6 species didn't have any problems whatsoever. They just, their immune systems are different. Viruses tend to be they like certain species because their bodies can multiply the virus easier. And those other 6 species of cats, their mechanisms and their cells just didn't work to multiply the virus.
Very interesting. So if I'm understanding correctly, our cats have more to be worried about from us than we do from them.
Yes, and it is our dogs, and because dogs they can find pieces of the virus in dogs that have not found an entire virus in a dog yet. But that's where there's still a lot of things about this particular coronavirus that nobody knows. There is a boatload of research across the world trying to figure out not only how to diagnose, treat, and take care of people, but also what do we have to worry about from our pets and just animals in general, and what do we do to test them for it, that kind of thing. And
So
just to add on to that, there are tests available to test our dogs and cats. It is really not recommended right now because the issue comes up is, one is if you have a cat that has a very mild upper respiratory infection, your treatment's not going to change anyway. And the second thing is there is no risk, as far as we know, and again, this is across the world, that there's no incidence of people being infected from their pets. It's always the other way around. People are the risk for the animals. And it's just a work in progress is the way I'd look at it. But right now, there's no evidence you have anything to worry about from any of your pets.
So how does the virus spread to our pets, right? Our cats aren't checking the mail or
Right.
going about gas station and grocery stores.
Right.
How does it transmit from us to them?
It's essentially just like it goes from person to person. People tend to pick up the virus because another person they were close to, there were droplets floating in the air that had virus, and we ended up getting it on us, and either we breathed it in or it got in our mouth or whatever. The same is true for all of our pets. If there is somebody in the house that has coronavirus and they're coughing and sneezing, there will be droplets flying around that our pets can be exposed to. And that's where, right now, and they're saying this as just as an abundance of caution, if you have somebody in the house that has coronavirus, they should stay away from not only humans, but they should stay away from their pets. They should not be hugging them, kissing them. You should not be feeding them, taking them out for walks. Somebody else should be taking care of that. And if it's not a family member, if you can find a neighbor or a friend, anybody else that could help you out with that, that would be phenomenal.
Interesting. What do we know about veterinary patient zero? I've heard that this started in the animal kingdom, most likely, and came over to humans. What do we know about where this started?
Well, they have pretty much proven that the virus itself, what is called SARS-CoV-2, which causes COVID-19, the virus has been the genetic genome of that particular virus has been proven to originally come from bats. And essentially, coronaviruses have never gone from a bat to a human. There's always an intermediate host of some kind. Like if we go back to the original SARS outbreak in China, well, basically Asia, they found that they just figured out 3 years ago, that virus broke out in 2002. They just found out 3 years ago that virus went through something called a civet, which looks like a cat. It's not really a cat, though. It's not in a cat. It's not in the same genus as a cat. But it went from the bat. The bat shared the virus with the civet, and then the civet shared the virus with humans. Whether it was because the concern in China was that the virus was spread through what they call a wet market, where they sell produce and meat. And more than likely, I don't know if they eat civets or not, but it's something that more than likely the civet gave it to the people from either handling the animal or from consuming it or however. They think the same thing is true for this particular outbreak. They do not know what the middle species was that went from bat to the other mammal to people. There's a thought that it might be something called a pangolin, which actually looks like an armadillo or an anteater. It's just big anteater, for lack of a better way to look at it. They also think it could have come from stray dogs, but it will be years before we figure out what the intermediate mammal was for this one. And then that boils down to what we kind of talked about already. The intermediate mammal shared it with us. The mammal that shared it with us may not have ever been sick from it. It may have just been a carrier that outwardly was seen perfectly healthy. And then the people were exposed to the same virus, and it either had already changed inside the intermediate or it changed inside some person and now is infecting people all over the planet. And that's what was the original mammal beside the bat? Nobody knows right now. There's lots of conjecture out there. It's very confusing, but again, once scientists spend a decade or so on this, I'm sure we'll know a lot more about it and hopefully be more ready, prepared, have everything we need for the next outbreak, whatever that happens to be.
I'd rather not think too long about what or when, as
Exactly. Hopefully
seems
never.
fortunately likely. You know, this has been so disruptive to life in so many ways, and I imagine to your practice as well. Could you say a little bit more about what you're doing professionally, what changes you have made in response to COVID-19?
Pretty much across the country and probably across the world, veterinarians are right now. We do not let any people in our clinic. We actually have them come into the parking lot. They call us and let us know they're there. We go out and get their animal and bring it into the clinic. Some of the doctors are calling the clients on their cell phones to just talk to them about, how things going, or why are we here? And right now we are only taking sick patients. We're not bringing animals in for routine vaccines, checkups, things like that. We bring them in if they're ill. Some of the young puppies we're still bringing in because if we don't vaccinate them, they're going to get ill. And there are some very serious diseases. We want them to essentially have their vaccines so they don't get them. But so it's basically just trying to not let people in the building. There have been some issues, and there was one clinic in the greater Pittsburgh area that had to shut down for 3 or 4 days because one of their employees was exposed to a COVID patient, not in the clinic, it was outside the clinic. So it's trying to be just making sure we all stay safe. On top of that, we're, essentially, we all wear a mask. Everybody wears a mask before you go outside. Interestingly enough, all of our delivery people, the FedEx, UPS, they're all wearing masks. We clean everything every time we touch it. Before we touch an animal, we wash our hands. After we're done, we wash our hands. If we go outside and if there's any contact at all, leashes, whatever, we just wash our hands. And then just disinfecting the clinic before, beginning at the end of the day, especially just to make sure everything, and that's just wiping down. Things as mundane as the computer terminals, trying to get the keyboards, without ruining them totally, that kind of thing. There's also lots of, if we have an employee that is ill, they basically just don't come in that day. It's just, and once they feel better, and we haven't had anybody with COVID as far as we know. Nobody's been ill or out for any length of time. Thank goodness, knock on wood. And everybody's been fairly healthy. That kind of sums it up. It's just kind of trying to keep everything clean and keep everybody safe.
I really appreciate it. So as a pet owner, how would I know when to call you, when to come in? What brand of illness are you treating right now versus staying at home? Should we just call and then you'll advise us? What's the best?
Well, we are doing more telemedicine, or just, we do have a telemedicine option. We do a lot of phone calls, and for simple things, there's a lot of things we can handle over the phone or through telemedicine. If it's something we need to see, like if they're not eating, they're vomiting, they have diarrhea, they're coughing, whatever, something that could be fairly serious, then we'll bring those patients in. We have some that have wounds on them. They were out doing something. Dogs and cats will be dogs and cats. They'll get abscesses from fighting with other animals, things like that. We need to see those and help them out. Surgery wise, we're really not doing anything routine either. And that's for 2 reasons. One is, again, just to keep fewer patients and people in the building. The other is to conserve personal protective equipment so that hospitals that need a lot of it, we're not using it as much, just trying to help them out. Basically things like that. It's
a consideration I never would have thought about. I imagine that you wear in surgery something very similar.
Right. Yes,
many
exactly.
layers of the same garments.
Right.
So What else? I've taken a lot of classes on Torah and not so many classes on questions I should be asking my veterinarian. What else would you like people to know in these uncertain times?
Well, there are certain things that you can do to keep everybody, basically your pets, you, everything. And we covered some of this a little bit. If somebody in your house is either has symptoms that they might have COVID, or if they are known to be positive, everybody should be wearing a mask. Keep the animals away from people and other animals. And that's where, when it comes to dogs, well, let's start with cats. Since they are actually a little more susceptible to it, they might have mild upper respiratory viruses. If you can keep your cats indoors, that should be the first thing to do. Now, knowing the temperament of some cats, that may not be feasible, because there are some cats that will let you know and know in certain terms that they want to go outside and they are going to go outside, or you are going to regret it. And that's just the way cats are. If you're taking your dogs out, and again, even though this has never happened, since there has been no transfer from a dog to a human, they still want you to keep your pets 6 feet away from other pets. Just, especially if you're from a COVID house, you don't want the dogs could conceivably have coronavirus either in their mouth, on their nose, it could be on their fur or on their skin. And that the fur and skin is really not that big a deal. They've actually found that, believe it or not, animal fur, and as weird as this is, paper money does not spread viruses real well. Like the droplets of fluid are sucked up into the fur, and it would be next to impossible for a person to pet an animal that was sneezed on an hour ago and pick up COVID. It doesn't seem to work that way. They've actually found, and I found this kind of hard to believe, but there is no virus, any virus, that has ever been proven to go from an animal fur to a human, ever in history. Now, we might be proven wrong with COVID-19, which is why, again, for abundance of caution, just be careful with your pets, social distance your pets. If you are ill with an upper respiratory or something that sort of faintly resembles COVID, don't touch your animals. Other than that, it's just an interesting problem going down that road is for people that have service animals, because they have to work with their animals. That's why they are there. And that just becomes, try to not touch your animal as much as you can. Don't pet them, don't hug them, don't kiss them, wear a mask when you're around them, wash your hands before you touch the animal if you want to pet it, or if there's something you need to help with, putting a harness on, putting a harness off, whatever, and wash your hands after you're done working with your pet. And that's one of those things you just really don't think about. Like, you have a service animal that's critically important for you, and you have to keep the pet safe to try to help other people and to help yourself more than anything. But the other thing that people sometimes don't think about, which this is important for any kind of an outbreak or any kind of an emergency, or even if it's a family emergency or a national emergency, ideally, if you have a pet that has a medical problem and is on medication consistently, ideally you should have at least 2 weeks of medication on hand, so that if something comes up and you can't get to a pharmacy for a week or two, you don't have anything to worry about. And if it's on a special food, 2 weeks of that in the house would be hugely helpful also. Because right now we don't have a big problem getting pharmaceuticals, and pharmacies are all open. We're not having any real big problem with our supply chain right now, but we don't know what's going to happen in the future. Right now all the medications are available, and just in case, you'd be better off having stuff around. Then on top of that, okay, just besides the interactions with your animals, if you have what could be COVID, or you've been proven to have COVID, that's when keeping your house clean becomes critically important for all the other people in the house, plus for your pets. Disinfect everything. When it comes to dishes and anything you're eating off of, hot water and soap is perfect. You don't have much else to worry about. And there is a myriad of cleaners out there that can work. And if you're in a pinch, you can use a very dilute solution of bleach. They actually have found that 5 tablespoons of bleach in a gallon of water will kill off COVID without a problem. And then there's a myriad of other cleaning things that either have bleach in them or what am I thinking of here? Oh, alcohol, like hand sanitizers and things like that. There's lots of products like that out there to keep your house clean and keep your hands clean and that kind of thing. But I think it's not too much else. It's just kind of doing the same thing for your pets as you're doing for you.
That's exactly right. It sounds like an abundance of caution and respectful social distancing is the way to go. I suspect we're going to be reading more and more and more stories about cats that are testing positive, right? It makes for good clickbait headlines and inspires fear and gets us all to tune into the 11 o'clock news. What you're saying is, while we want to do everything in our power to protect them, we shouldn't be getting rid of our cats, that they are not a danger to our health.
Not at all. There's no cat that I could find any evidence of that ever passed away from coronavirus, at least this particular version of it. And the same is true for dogs. And even those big cats in the Bronx Zoo, they got mild upper respiratory problems. They all got better and they're all doing fine. There was a little concern at one point because early in this particular corona outbreak, there was two dogs in Hong Kong that were found to be carrying COVID. One of the dogs that was positive was actually quarantined for a short time. He was fine and then went back to the owner. And then unfortunately ended up passing away a few days later. But the dog was 17 years old and had heart failure and kidney problems. So the feeling is that dog did not pass away from a coronavirus. It had 17 years old is a pretty old dog. God bless him for living that long.
Right. Dr. Paul Volz, Run Veterinary Clinic, thank you so much for your time, for the work that you are doing, and for this advice on how to keep ourselves and our pets safe.
Well, thanks for the opportunity. This was fun.